The important thing is that people are already rethinking medicine, and they're rethinking it from a number of different angles. There's a number of different manifestations of the way in which we're all rethinking medicine. My sense is that if we continue along those paths, there's going to be multiple paths which are all leading out from the centre and moving in very different directions. So I think that's what Rethinking Medicine is about bringing together a number of those manifestations which clearly overlap, demonstrate the overlaps, develop that narrative that helps people understand what the overlaps are, therefore help people to work more together. So I'm a policy person, and although I'm a clinician by background, I guess I started rethinking medicine from very early on in my career. Quite honestly, I gave up medicine for a few months very early on in my career because I thought it did need profoundly rethinking. I was very much influenced by Illich in the early years of my career. So I've always been kind of rethinking it in a multitude of different ways. Now I'm in policy. I guess what I'm seeing centrally, to be quite honest, is quite a fragmentation, a lot of different initiatives, which in many different ways are rethinking medicine. But again, they're not really being clearly brought together in a way that makes sense for clinicians working in everyday practice. What's really stayed with me was Victor Montori's talk. I've been very influenced by Victor over the last 3 or 4 years since I've known him, read of his work. You know, he talks about elegance, care, kindness, love. In my world, I talk about targets, incentives, accountability. They're uneasy bedfellows, but they're bedfellows that we need to bring together. I think we've perhaps lost the balance. We're more focused on targets, accountability and performance, and less focused on what actually really matters, which is about the humanity, the relationships that are at the heart of really great healthcare. It's a great question. I guess dig into yourself, have a walk around it, figure out what your attitude to this is. Figure out, I guess, in a sense, your values. And I think most of us came into healthcare for really good reasons, with really solid, positive, optimistic values to do with care, to do with kindness. So there's something for me about reconnecting with those values. And at heart, I think that's what Rethinking Medicine is all about.